Diabetes is a chronic disease that affects different groups of individuals worldwide. My name is Arturo Loyola and my Module 6 presentation is Type 2 Diabetes in Maryland. Diabetes is a chronic disease which is prevalent in Maryland as shown in this slide. Diabetes is one of the major causes of morbidity, which will cause other related diseases such as cardiovascular disease and chronic kidney disease. The population most affected are non-Hispanic Black adults and older adults with lower education and low income. Geographically, these groups are found in Baltimore City and some rural areas of the state. As key social and structural determinants, we can mention that the population with low income, low education, and unemployment will experience less access to healthy food due to its cost. Other factors such as lack of transportation will prevent also for these people to access this food that they require. The specific modifiable risk factors are obesity, physical inactivity, and unhealthy diet, which will cause hypertension and dyslipidemia. Smoking and stress are also other relevant risk factors. But why do we do surveillance and screenings? We do diabetes surveillance to track the prevalence and hotspots within the states, while we do screenings such as HbA1c glucose test and fasting glucose to diagnose and provide the proper treatment. In Maryland, the main surveillance and screening challenges are related to the number of underdiagnosed individuals and the barriers to proper screening such as transportation, insurance access, and inability to speak English in some cases. As mitigation strategies, it is important to mention the integration of the community screening data and the expansion of mobile clinics with health professionals in the most affected areas of the state. In addition, it is crucial to partner with food, housing, and transportation programs. As example of interventions informed by risk data, I would like to mention that the National Diabetes Prevention Program, which targets the zip codes of high prediabetes prevalence and hypertension and obesity clinics located in FQHC locations. The department would use this information to fund high-burden communities, monitor real-time hotspot areas, and evaluate interventions using linked surveillance metrics. As a takeaway and action items, we should focus on social determinants of health when assessing risk, learn to interpret surveillance dashboards, and behavioral risk factor system variables. Supporting community screening events are also important. These are my references. Thank you.